Hello, Dr. Martinez. How are you doing today?
Doing fine, thanks for asking. Except for a common illness my people are plagued with in the Caribbean.
Really, you must tell me more about this illness you're speaking of. What does it do to your people?
Well, Dr. Skinner, the symptoms my people show are sudden attacks of crying, trembling, uncontrollable shouting. Sometimes my people that are plagued with the ataque de nervios have intense heat going from their chest and eventually reaching all the way up to their head.
This definitely sounds intriguing, Dr. Martinez. Have you began thinking of any treatment options for your people inflicted with the
Ataque de nervios.
ataque de nervios? Maybe we should talk about the symptoms of this illness.
Well, sometimes my people, they feel like they get removed from their body and their spirits lift out of them. Then other times they might cry and tremble and they don't even know why.
These are important points. Really interesting. I'll definitely consider them, but Dr. Martinez, can you be real with me for a minute?
Yeah, what is it?
Are they serious about these evil spirits?
Yeah, absolutely, they're serious. These evil spirits are thought to cause random outbursts of crying, out-of-body shakes, shouting.
You know what, Dr. Martinez? I think I know how to get to the bottom of this. I believe your people are suffering from panic attack symptoms caused by panic disorder. That's what we call it in the States anyway. And you shouldn't fret about the evil spirits. They're not causing these things. Usually panic attack symptoms are because of your biology, your genes, the environment you grew up in, major life stressors, having a death in the family recently, among many, many other things. We could start some treatment options for your people, ranging from psychotherapy to some medications that may alleviate their symptoms that your people are having.
That sounds great. Let me take these findings back to my patients and hopefully their illnesses can be better treated.
Right.
Thanks.
Yep. Hello, Dr. Campbell. How are you doing today?
I'm doing fine, thanks for asking. I could use your help though. Unfortunately, there's a common illness my people are plagued with in the southern United States and Caribbean, and I'd like to get your feedback about it.
That's very unfortunate to hear. Tell me more about this illness you speak of. What is it called? What does it do to your people?
Well, Dr. Skinner, the symptoms my people show include sudden bouts of dizziness, almost a spinning sensation. The condition is called falling out and is believed to be a psychological response to anxiety and stress, and sometimes happens when the patient is in a very shocking situation. It could be pain-related as well.
Wow, that sounds pretty unsettling, Dr. Campbell. This sounds like something very similar to an ailment where I'm from. It's called passing out. It shares almost exactly the same symptoms as falling out and affects people in very similar ways.
That's extremely interesting. I had no idea other cultures shared such a similar ailment. I guess we happen to have different names for the same condition. How do you treat those affected with passing out?
Well, usually rest and relaxation is all that is required. Once the patient calms down a bit and gets their bearings, they can go about their day normally. It's not categorized as an illness unless it becomes so common that it begins to seriously impact the quality of a life for the patient.
Very interesting. This is great to know. I'll continue to treat my patients in the same ways that you treat those affected with passing out.
Great.
Thanks so much for your help.
No problem.
Good afternoon,
Hello.
Dr. Skinner. I heard you might be able to help out with a certain patient of mine.
Well, I'll certainly try my best. What are his symptoms?
Well, his name is Matt, and he's a 35-year-old man with a pregnant wife at home.
Okay.
The strange thing is he believes he's actually pregnant himself. He says that he has had minor weight gain, altered hormone levels, morning nausea, and even disturbed sleeping patterns. It's something we call Kubade syndrome from where I'm from.
Okay, well, Matthew, right?
Yes.
Yeah, well, tell Matthew that we have something very similar here in the States. We call it sympathetic pregnancy. It's a condition in which the partner has some of the same symptoms and behaviors as the pregnant mother.
Oh, that's very interesting. I never knew there were other places that knew about this syndrome.
Well, yeah, let him know that other men really do suffer from pregnancy symptoms with sympathy for their partners. Fathers have also been seen to endure cramps, back pain, mood swings, food cravings, morning sicknesses, depression, many other symptoms.
Is there anything I can do to help him out?
My advice would tell Matthew that it's all in his head. Just tell him that it's medically impossible for a man to become pregnant unless he gets a sex change. But usually it's because of stress and empathy for the partner. Assure him that the condition is temporary and it's not serious at all.
Thank you very much. I can't wait to tell him the good news that his condition isn't serious.
Hi, B.F. Skinner. I was wondering if you could help me out with this patient I'm currently treating.
Oh, of course. What seems to be the problem with your patient?
Well, Doug here,
I'm Doug.
he's experiencing nausea, vomiting, and what I would consider a poor appetite. Also, he tends to be very antisocial with me, as well as the many nurses who are keeping an eye on him. As you can see, he's restrained at the moment for the hospital's own safety.
Well, Doug seems to be going
I'm
through
Doug.
quite a lot. What kind of poor appetite are you referring to?
Well, actually, he seems to be trying to eat people. We received Doug from an Algonquin
I'm
tribe up
Doug.
in Canada, and they didn't know what to do with him, and I thought you would be the best person to ask about this illness.
Yes, you definitely came to the right person for this. I think Doug is suffering from a Wendigo psychosis.
Well, that sounds very serious. How can this kind of illness develop, and are there any known cures?
Well, some people say it has been rumored that humans become possessed by the Wendigo spirit. After being in a situation of needing food for so long, having no other choice besides cannibalism, any type of positive reinforcement will surely go a long way in curing your patient.
Thank you for all this information. It seems Doug is trying to break free of his restraints.
Oh,
I'm doing fine, thanks for asking, except for a common illness my people are plagued with in the Caribbean.
Really? You must tell me more about this illness you speak of. What does it do to your people?
Well, Dr. Skinner, the symptoms my people show are sudden attacks of crying, trembling, uncontrollable shouting.
Sorry, I'm gonna ask. Usually panic attack symptoms are because of your biology, major life stressors, having a death in the family recently, and among many other things. We should start some treatment for you, ranging from psychotherapy to some medications that may alleviate the symptoms you're having.
I don't know how to end it.
Hello, Dr. Martinez. How are you doing? This is stupid.
Good afternoon. B.F. Skinner.
hello, Dr. Campbell. How are you doing?
Hi, I'm doing fine. Thanks for asking.
So,
Sorry.
it's very
Well, Dr. Skinner, the symptoms my people show include sudden bouts of dizziness, almost a spinning sensation. The condition is called falling out, and it is believed to be a psychological response to anxiety and stress, and sometimes happens when the patient is in a very shocking situation. It can be pain-related as well.
wow. That's very fuck. Fuck. It's very unfortunate to hear. Tell me more about this illness you speak of. What is it called? What does it do to your people?
Well, Dr. Skinner, the symptoms my people show include sudden bouts
You
of
opened the door.
dizziness.
Good afternoon, B.F. Skinner. Come on, man.
You gotta be kidding me.
It's so stupid. Alright.
Okay. Take
1713.
Let him know that other men also suffer from pregnancy symptoms with sympathy from their partners. Fathers I messed up. Yeah.
Okay.
Let him know that men really
Fathers have been
do. Let him know that men really do suffer.
Still going, guys.
Huh?
Come on, man.
Oh, that was it. All right, hello. When I say, well, Doug. Hi.
Oh. I was wondering if you could help me out with this patient I'm currently treating.
Oh, of course. What seems to be the problem with your patient?
Well, Doug is experiencing.
Come on.
We received Doug from the Algonquin tribe. We received Doug from an Algonquin tribe up in Canada. They didn't know what to do with him, and I thought you might be the best person to ask about this illness.
Yes, you definitely came to the right person for this. I would think Doug is suffering
I'm
from
Doug.
a Wendigo psychosis.
Sorry.